It all started simply enough. Two people, one in Rwanda and the other in New Zealand. Together, Olivia Karasira and myself committed to simply try and make something good happen in African healthcare. 18 months later, now with a full team, we could not have imagined the outcome that is Ejo Health today. We started by helping medical professionals in Rwanda, Burundi and Nigeria become data champions, using SNOMED and FHIR to build bridges with people around the world wanting to build a personal copy of their healthcare data. We made a YouTube video of the process in June 2020 called Getting Started in Rwanda and Burundi with FHIR and SNOMED. The video came to the attention of SNOMED International, who kindly offered us a free developer's license for 2 years to see what the Sovereignty Network could make happen using SNOMED. By the end of 2020, we had merged with another New Zealand company, Ejo Health, and presented an idea to SNOMED International. Support us to build out maternity and child health modules on our application using SNOMED. Using a tablet or iPad, we promised to revolutionize the difficult work of community health workers at the front line of Rwandan healthcare, often in remote villages and replete with all the difficulties of using only paper. SNOMED International grasped the vision, the potential outcomes, and supported us to do the work.
The need to make a difference to healthcare delivery in Africa is something that dovetails rather well with the larger goals of the African Union. Digital health on the continent and what it represents is a significant component of the African Union's digital transformation strategy, spanning the current decade 2020 to 2030. Digital health and its focus on integration and interoperability of solutions shows great promise in supporting health system transformation. This highlights the need for the consistent use of universally accepted clinical and technical standards. So, what are the health goals defined by the African Union as they apply to interoperability? Firstly, ensuring interoperability is a strategic priority of the African Union's plan needs to be a critical component of each national digital health strategy. This is a prerequisite for the successful implementation of digital health initiatives. Secondly, recognizing that the African Union desires to set up a task force to oversee standard selection and interoperability issues, Ejo Health has adopted a similar process at a micro level, this being a grassroots approach to assessing, selecting, and implementing international standards into its platform. Thirdly, like many places in the world, while there has been progress on digital health, in Africa, substantial barriers remain because the foundation elements have not been adequately addressed. Finally, synergies between the African Union, the World Bank, global standards development organizations, and industry partners like Ejo Health are critical. The development of health technology and universal health coverage present impactful opportunities to drive change for the patients and the citizens of Africa.
Community health workers are not clinicians, but they work at first line of public health care for so many people in Africa, often working without pay. They and their patients frequently find themselves working in heartbreaking situations, and equipped, inadequate, and late data often results in tragic outcomes. Many would be avoidable with more accurate, standard-based data, along with timely reporting. Operating with only the most basic resources, it perhaps with the community health worker that the most transformational change can be made, improving workflow, training and education, reducing errors, engaging patients and improving the level of care, surfacing data for the very first time, making it immediately available for triage, as well as public health analysis. And measuring outcomes can lead to more efficient resources allocation. We have chosen to initially focus on two areas where the most impact can be made on health throughout Africa: maternal child health, well-being. We have first implemented at Remera Health Center in Gasabu district, Rwanda's largest health center and frequently the site of the country's most innovative healthcare projects. Located in Kigali, Gasabo district provides access to over 1,700 community health workers and more than 151,000 households. This represents 5% of the total population of Rwanda.
Today, I would like to present to you how technology can support clinicians, community health workers on their workflow. Do you really understand their daily challenges? For this video, I would like to focus on community health workers' forms, family planning, pregnant women, delivery, child health forms, represent more than 6 meters, more than 16 kilos to carry, more than 700 manual records, all that can fit here. And the most important part, help the community health workers to deliver the right treatment.
inshuro zose 3 wari wazipimishije?
Yego.
Ihangane muganga mbwiye ko ambirasi ije, duhaguruke. My daily task is to supervise community health workers with their different activity and their report. It takes a long time to supervise their report and the different activities manually. After 15 years of experience working with community health workers, I recommend technology. Focus on facilitating analysis and reduce error from the report. Today, I needed to go through several reports before taking my decision. Sometimes that can delay my decision. Thank you.
Let us begin with drilling down on the development and preparation process. In Rwanda, the journey with SNOMED International started in January 2021, when we started to build the Ejo Health program with Remera Health Center. The first step was building FHIR and SNOMED compliant electronic forms in French, English, and Kinyarwanda. The second step was to identify in Gasabo district areas where we need offline mode. The 1st February, Gasabo district granted our request to build electronic forms for community health workers with Remera Health Center, Rwanda's biggest health center in the Gasabo district, representing 5% of the population in Rwanda.
To work closer with Ejo Health, we offered an office at the administration block of Remera Health Center to achieve our dream of paperless workflow for community health workers and nurses.
Morning. As you are all aware, Gasabo District has always been supportive to improve health. Let me first introduce myself. My name is Alphonse Tarinwa. I'm in charge of public health at Gasabo District. Last time we met here because the Gasabo District administration is supporting the Ejo Health program. We request community health workers to embrace this technology because we are lucky to have an opportunity to solve health challenges in our district and to reduce errors sometimes identified during children consultations in our villages.
Mwabyumvise neza uburyo bwo gukoresha ikoranabuhanga rya Ejo Health. Ngaho nimufate advantage ibona polisi.
Mbere na mbere duhera ku mwirondoro w'umurwayi.
During the consultation, I first record the client profile. Then we capture the illness in Ejo Health. There are 4 categories of illness: fever to track malaria, cold, and cough. Where we identify pneumonia cases, then diarrhea. And in case of something else, we record it here in other illness. We screen danger signs that are related to the current illness. Then we test and treat according to illness algorithms that will reduce errors and time we spent on consultation. What took me 20 minutes before can be done in 5 minutes using Ejo Health. What I love more about Ejo Health, necessary calculations are now easy and reports are automated.
Jeanne Pokwizera is filling an ICCM form, Integrated Community Change Management, used by community health workers to consult children between 2 months and 5 years old. The maternity module has also been developed, and this program will launch soon. The Ejo team who worked on the development is composed of clinicians, healthcare software developers, FHIR and SNOMED experts from around the world, including some of the best individuals in informatics and digital health. Working with the Remera Health Center, we have effectively managed to map and digitally customize the Ministry of Health community health workers forms in Kinyarwanda, French, and English, aligned with the World Health Organization's guidelines, and incorporates SNOMED international codes and terminology.
The experience of the Ejo Health program for the community health workers has been a success, even at this early stage. We have seen process improvements, and the community health workers have great positive feedback. This creates a solid foundation to begin to measure health outcome benefits for patients and populations. The beneficial observed process outcomes to date for the community health workers are as follows. It is faster than the paper forms. There is no shuffling of forms and notebooks. It is more streamlined, and there is no need to refer to other materials to check instructions. It is easier than the paper forms. The flow is more logical, and proper use is much clearer. It is safer than the paper forms. There is no need to look up medication doses or growth parameters. They are determined automatically by the app. It is impossible to miss any danger signs. The form cannot be completed unless all have been checked. Equally important to all this is that it is achieved while also delivering a massive boost in data quality. Digitization into open, structured data formats will make it possible to easily measure clinical outcomes going forward, both for individual patients as well as for populations. This aligns directly with the African Union's Digital Transformation Strategy for Africa 2020 to 2030. As we move forward and continue to extend Ejo Health within Africa, developing an approach to progress from observed process outcomes to measured health outcomes will be vital. This will require collaboration with regional, national, and international health policy experts and decision makers, and creates opportunities for large organizations with an interest in spurring development in Africa, such as the African Union, the World Bank, and others, to support projects that can readily demonstrate beneficial health outcomes. SNOMED CT empowers us all to speak the same language.
Over the past year, I have worked as a data champion for the Sovereignty Network and helped to contribute to the Ejo Health program in Rwanda. In fact, the vision and mission are so important to me that my husband, also a medical professional, has also joined in. The Ejo program is particularly important to me because it is focused on supporting community healthcare workers in child and maternity care to make their jobs easier. I look forward to see the Ejo program in Rwanda because I know it can work in Burundi and help to address our many challenges in capturing patient data, managing patients, and providing us doctors with appropriate reports in real time. With the support of partners, we hope to see the Ejo Health application in Burundi soon. Yes.
Kugira amakuru y'abarwayi muri Ejo Health bidufasha gukurikirana neza abarwayi no kubavura neza, bidufata umwanya muto kubavura twirinda amakosa yaboneka, ni uburyo bushyashya ni iterambere ry'igihugu cyacu mu gukoresha ikoranabuhanga, biturinda gutwara ibitabo biremereye mu myaka mfite.
Muri gahunda y'abajyanama b'ubuzima twari dusanganywe ikoranabuhanga rya Rapid SMS rifasha umujyanama w'ubuzima gutanga amakuru ku kigo nderabuzima igihe umurwayi yagize ikibazo. Ariko Ejo Health ije ari iterambere rikomeye mu ikoranabuhanga rizafasha umujyanama w'ubuzima mu gutanga amakuru igihe turi kuvura umurwayi dukoresheje tablet kuko tuba dusangiye amakuru ako kanya n'ikigo nderabuzima.
The Ejo Health App has the technical capacity to expand rapidly, leveraging SNOMED and FHIR to integrate with electronic health records such as OpenMRS and IHMS. Region-specific diseases can be highlighted, leveraging SNOMED structured data elements and analysis capabilities for population health to see how different people react in different areas. Clinical areas to expand next include women's and men's health, along with non-communicable diseases. Geographical areas to consider expansion to include the rest of sub-Saharan Africa, India, and Southeast Asia. Ejo Health's adoption of data standards provides preferred access to markets where standards are being adopted and/or mandated. The interoperability provided by SNOMED's semantic standardization and FHIR's messaging standardization places Ejo Health at the forefront of a world where people are more mobile than ever before. The vision of the Sovereignty Network, where data is in the hands of the people, can assist a post-COVID world demanding mobile, structured records that follow people as they begin to move around and travel again. The data is able to be shared under their control. Low digital maturity in healthcare is a barrier that can be partly overcome having an app in the hand of the head of household as well as the community health worker. There are no limits to where this can go. Reliable, timely and standardized data to inform health policy changes, improve the supply chain, improve care delivery capabilities and empower people and communities to better manage their health and be stewards of their data. We welcome the opportunity to collaborate with others to show that African and other developing nations' healthcare can leverage SNOMED data structures and FHIR data interoperability to leapfrog so-called developed nations from Africa to the world.